Hello everyone, you are all welcome to lecture number 1299, and today's topic is vitamin B12 deficiency in adolescents, causes, its sources, and finally the treatment. My already one lecture is there on B complex group of vitamins. They are water soluble, and more especially B12, because recently I went through some publications and that is very much alarming, and that's why I decided to discuss this issue. Because nowadays, due to carelessness or ignorance, and many people they don't realize, they don't understand the meaning of B12 or its role in children. B12 is cobalamin and it is a coenzyme, and it has very important role, especially in adolescent and in children. And of course to all of us, but more especially in children. And why more than 60% children globally, once it is checked and tested, they are deficient in vitamin B12. And vitamin B12 deficiency may start from fetus, even from pregnancy. Because if the parents, they are deficient in vitamin B12, there is chance that the child will also be deficient. So first condition is, make sure that if your child is born as an infant and your test is deficient in B12 as a parent, you must get checked the B12 status. Otherwise, it will create lot of complication. And mainly why it is deficient in adolescent. The reason is that adolescent, they are very active and they need lot of energy, lot of oxygen, and they are involved in lot of outdoor activities, running, going down, and with friends playing sometimes cricket, football, lot of outdoor activities. During that activities they need lot of oxygen and lot of energy. And you know that vitamin B12 is one of the vitamin which is involved in the synthesis of red blood cells. Is a very main role of vitamin B12 is there. And if there is lot of consumption of energy, they need more and more vitamin B12, because lot of RBC red blood cells are used to carry the oxygen throughout the body, because RBC is the carrier of oxygen in the body. And once lot of energy is used, lot of RBC is used, lot of oxygen is used, that's why lot of B12 is also used. And that is one of the cause that adolescent children, teenage children, generally they are deficient in vitamin B12, and parents they don't care, because it's not the, we can say, our practice as a parent to go and get checked vitamin B12. Because we don't give much importance about this vitamin B12. So these latest lot of research publications have opened the eye that it is so important. The second thing is that this vitamin B12 is very important for your neuron cell synthesis, your dopamine, neurochemicals, serotonin, then your all the messenger transmission molecules, they are all connected to your neuron cells, and neuron cells they need lot of vitamin B12. So if in case there is deficiency of vitamin B12, then there will be problem of mood disorder of children. They will be irritated, their memory will be less, and of course the brain function will be dull. So this is also one of the very important for adolescent. And third factor, in parents who are vegetarian, or the children who are vegetarian, because B12 is the rich source from animal products. Animal products are the rich source of B12. First number goes to egg for children. That's why I always used to advise, if we can afford, better give always every day one egg, either in the form of omelette, boiled, or cake, or any form. Egg should be there, some fish should be there, chicken nugget should be there, some meat preparation should be there, so that they are getting enough vitamin B12. And those children who are strictly vegetarian, there is maximum risk of getting deficient in vitamin B12, and that is very serious matter, because overall health, starting from mental health to energy to mood, memory, digestive system, because it is coenzyme also, your gut health, everything will be affected in your body once there is deficiency of vitamin B12. And my advice as a professor of medicinal chemistry, better to get checked. If you see some symptom that your child is always feeling tired, fatigued, if he is going to play very easily, he is exhausted, his energy is lost, he cannot compete with all other children within no time, he will feel tired, definitely there is high risk that he might be suffering from a deficiency of vitamin B12. And the latest publications, they are showing that up to 50%, up to 50% American adolescents, they are deficient in vitamin B12. American adults, up to 40% they are deficient in vitamin B12. If you come to Asia and Africa, up to 60% children, adolescents, they are not having normal vitamin B12 and they are all deficient. But luckily, in those countries where they are using lot of animal products, the chance of deficiency of vitamin B12 in their children, in adolescents, is very minimum. So in that circumstances where adolescents or children, they are deficient in vitamin B12, either you put them on supplement, or if it is chronic condition, no harm if doctors, they suggest, you discuss with doctor, and it can be given by injection. So it is very important, especially for example in India, a lot of people are strictly vegetarian, they even don't go and take eggs. Then there is a maximum chance that in adolescents there may be chance of a deficiency of vitamin B12. But if they are taking some dairy product like cheese, yogurt, milk, there is chance of recovery, and of course the deficiency chance will be less. And if, because most of the adolescents and children, they are not careful in their diet or nutritional value, mostly they go for sugary item like cake, toffee, sweet tablet, and lot of other sweet preparations. And these are all factors which are very harmful to adolescent. And I am going to just give the summary, and what are the amount required for all these things to take care. So here my observation is that why there is a deficiency of B12 vitamin in mainly adolescents is because of lack of awareness and carelessness. So please, and the reason is that they don't know the importance of deficiency of this B12. I've already told you, and also some other factors I have given here, like the immune system. If the child is deficient in vitamin B12, the WBC will not be synthesized much, and WBC is the fighting force for any pathogen or any bacteria which is going to attack. So it will be very much having low immune system, and also the child will be always in bad mood, irritated, headache, temperamental. All these factors are directly, indirectly associated to the deficiency of vitamin B12. So here I have given the summary. Number one, vitamin B12 is a water-soluble vitamin, and that plays important role in various body growth and functions. Vitamin B12 is necessary for the production of red blood cells, that is called RBC, which carry oxygen throughout the body, providing energy to cells and tissues, which are very important for children. Number two, vitamin B12 is required for the synthesis of nerve cells and facilitate the function of nerve signals, and also plays role in the synthesis of very important hormones, that is called dopamine and serotonin. And these two neurochemicals, they are responsible for maintaining good mood, happiness, and controls depression and anxiety in adolescent children. Number three, vitamin B12 is required in bone health and immune system for the production of WBC, that is called white blood cells, maintain healthy immune system and bone in children and adolescents. Number four, vitamin B12 is necessary for skin, hair, and nail. And if you notice that your child is having thin hair, or adolescent child where he is losing lot of hair and his or her nail is brittle, skin is rough, definitely it is due to the deficiency of vitamin B12. Please find out the deficiency by test. Then number five, sources of vitamin B12. The main sources are animal sources, egg, meat, chicken, and for vegetarian it is milk, yogurt, and cheese. And here I have given the doses of vitamin B12. Recommended daily intake for vitamin B12 is, for example, for infant, the one who is from 0 to 12 months requires 0.5 microgram, and the adolescent from the age group of 1 to 18, they require 2.4 microgram of vitamin B12, and adult starting from 20 up to 60 years, that they require 2.4 microgram, and pregnant women they require 3.0 microgram. They need more because of the growth of the pregnancy and infant. That's why they need more and more. And the maximum amount of B12, those mothers who are feeding their infant, please keep on B12 rich food and take some supplement if it is necessary. And once you are there as a feeding mother, please get checked the status of your B12 and improve it if it is deficient, because it is going to affect your child in the long run. Then number 6, causes of deficiency in adolescent. Number one, dietary factor. I have already discussed dietary factor, that if you are not taking such type of animal products, there is high risk to be deficient. Malabsorption in some children who are having some digestive problem, celiac disease or acidic condition where proper absorption of B12 is not there, they may get deficiency. Number three, high demand in adolescent age. I have already told you that they are very active, they need lot of energy, lot of RBC activity, lot of oxygen, and in that activity it becomes less and they become deficient. And then number four is maternal deficiency in child. It comes from mother's deficiency. If mother is deficient in B12, there is maximum chance that child is at high risk of deficiency of vitamin B12. And symptoms. The symptoms of vitamin B12 deficiency is fatigue, headache, and forgetfulness, memory loss, anxiety, irritation, all this, and then also hyperstate and muscle weakness. These are all symptoms of vitamin B12 deficiency. Then the treatment, very simple treatment, increase the consumption of all those animal products like egg, meat, fish. Go for oral administration, and if in case it is severe case when all the symptoms are appearing, then best you go for injection or intravenous by consulting the doctor and getting their advice. Please give enough vitamin B12 so that their normal growth of brain as well as RBC and WBC is there. So with this I will stop. Thank you very much for watching the lecture.